We often talk about reliability and resilience as some of the most important factors in supply chain and healthcare. Let's talk a little bit about why, in your experience with HSHS, why is it important to have these strong relationships with your healthcare partners?
Well, I think first and foremost, healthcare and supply chain it's a moving target, even in the best of times. And I think that the deep partnership and knowing that both sides, not just one, both sides can be resilient and roll with the punches. It's imperative. Frankly, the partnerships that you have that aren't that way don't work, and you have to look for an alternative. And I've never had to worry about that with Schein.
Let's talk a little bit about that. I think we both agree at the end of the day, excellent patient care is what we're all striving for, certainly in these most trying times. But how important was that first relationship building and open lines of communication in supply chain and with your partners? How much of that played into being able to overcome some obstacles?
It's unbelievably important. If you don't communicate about what you need, if you don't talk about your fears, if you don't talk about when you're going to need supplies ASAP, you're shot. And I think, in this partnership, myself and my organization, we are painfully transparent. We let you know exactly what we need, and you guys understand that, and you let us know what can be expected, and we know what we can get out of it. If you sit back and just think things are going to happen magically, those were the organizations that struggled. But I knew the second that any of these big obstacles occurred, I knew who to call, when to call, how to escalate it, for lack of a better term, and we got through some battles, and I'm sure that it will continue. But I never feel panicked. My organization never feels panicked because we work so hard at getting that just deep-rooted trust and relationship built.
Andy, let's shift gears a little bit. Our companies have a partnership that goes beyond supply chain fulfillment. Your organization has a organization called HSHS Mission Outreach. We have partnered, or you guys have partnered with Henry Schein Cares program, and that shared commitment of what we often talk about as doing well by doing good. How's that improved both our organizations, and how has that been something that has gone a little bit beyond, like we said, the supply chain and helped us both?
It's more of the value add. It's how do your companies align? It's very easy to feel comfortable with a company when you know that it's more than just about the widgets you're going to send and what we're going to pay for. You understand what we do outside of our daily dealings with our local patients. And I think every company you have, you need to dig down to that layer now. It's not just about surface needs. It's about how you view culture and how things work inside your organization, and how can the two of you work together to get better outcomes.
Andy, let me thank you again. This has been great. I want to thank you and HSHS for your partnership and being with us and navigating the challenges of healthcare supply chain.
Thank you.
Thank you, Andy.